Hi guys, this is Dr. Ben Turani. Today we're going to talk about ingrown toenails. An easy way to prevent ingrown toenails is to see your podiatrist and make sure that the nails are being cut straight. And if you have any pain or what you think may be an ingrown toenail, to see your foot doctor as soon as possible to make sure that this gets treated immediately. The problem is that if you don't treat it quick enough, this can turn into infection. We're talking pus, redness, swelling, pain out of proportion. A lot of my patients, they come in even if they're not sure if they have it, but I recommend just going in to see your doctor to make sure that there's nothing else going on. We typically remove the nail, so you can see here there's a little bit of nail debris, but an ingrown toenail, you'll have a lot of swelling and redness in the corner of the toe. And so, as soon as you touch it, if you press on it, there's a nerve on each side of the toe, and so that's why when it's inflamed and it's puffy, it hurts. That nerve is inflamed, it's swollen, it's not happy, that's why you experience pain. But when you wear flip-flops and sandals, most of the time it doesn't press against that part of the nail and it doesn't bother you. So we have to remove the corner of the nail and make sure that the nail doesn't grow back in some instances. Basically what we do is numb the toe. We remove the corner of the nail. Once that nail has been removed, we put some antibiotic and a dry sterile dressing. I tell all my patients to soak it with Epsom salt with a little bit of lavender oil in warm water. It helps reduce the swelling. If there's an infection, we'll put the patient on an antibiotic. But one thing to note, that when you're cutting your nails, make sure not to cut it at an angle. So it's always nice and straight across. Do not cut it at this type of an angle, at that type of an angle, because the nail will grow in that direction, and over time that's what can lead to an ingrown toenail. So there's many different things we can do. I have my patients file it, simple nail file, especially work on the corners to make sure it doesn't grow in. We have medications for fungus. I have something called Care Nail Gel, which is a gel that's really healthy for the nail. It doesn't need to have fungus, doesn't need to be infected. I just use this. It has camphor oil, eucalyptus oil, tea tree oil. It's really healthy for the nails. And then if patients also have an infection, we have a nail polish called Claris that's prescription only that we use for that. But with ingrown toenails, you need to pay close attention to the corner of the nail. If it looks like it's digging into your skin, it probably needs to be removed. Okay, there are instances where we can burn the skin where it doesn't have to grow back again. This works about 90 to 95% of the time. There is a slight chance it could come back, but we use a chemical that burns the root of the nail so the nail can't grow out anymore. So in instances where you have really bad fungal infection of the nail and the nail's ingrowing, it's probably best just to remove the entire nail and allow the new nail to grow back. And once that new nail is growing back, you can apply the same medications that I have on there. So if you guys have any other questions, let me know. But that's just my 2 cents about ingrown toenails and how to treat them, and then more importantly, how to prevent them. I'm Dr. Turani. Thank you.